My name's Jennifer Goldzak, and I'm the CEO at the Digital Medicine Society. Our healthcare industry runs on third-party evaluation. Whether we're relying on regulatory agencies or independent certification bodies, trusted arbiters are essential to reducing the burden of all of the different stakeholders seeking to ensure that the decisions that they are making about the products and services intended to care for people are as well informed and efficient as possible. Digital health software products have matured rapidly and are redefining patient care in the digital era and transforming just about every aspect of our industry. Yet, the buyers and end users of this new generation of digital health software products, healthcare systems, payers, and patients themselves are struggling to discern between those solutions that are high quality and trustworthy and those that are not. The burden of selecting and implementing digital health software products falls entirely on the individuals the digital health market is intended to help. Selection is cumbersome, confusing, and time-consuming, and the process is not sustainable. Simultaneously, developers taking the time and making the investment to build great, high-quality, trustworthy solutions struggle to differentiate their product in a crowded market. They're frustrated that their efforts to bring superior digital health software products to market are not recognized through broad adoption and commercial success. And rightly so. Digital health software products have the potential to fundamentally transform the way we care for people. But trust in our ecosystem is fragile right now. There have been too many instances of security breaches, abuses of data, and violations of privacy and data rights. There have been too many instances of bogus claims and inequitable outcomes. There have been too many software products that have overpromised and underdelivered their capabilities to health systems, failing to deliver on the usability and impact, alienating clinicians, and wasting precious dollars. The end user community, health systems, payers, and patients is guarded about how and when they share their data. We are losing their hearts and minds. And if we don't fix the problem now, it will take us decades to build back the trust necessary to reap the full benefits that digital health software products offer our industry in crisis and the patients that we exist to serve. There's also a massive risk to developers if we don't establish a common baseline of trustworthiness and quality. The market will falter. It will become harder to sell if we continue to erode trust and make the experience difficult for end users. Investors, developers, and anyone who's looking for commercial return in this market will struggle. And those developers who have been doing the right thing all along will be punished too. When we look to define what good looks like for a digital health software product, it doesn't have to be that complicated. For a digital health software product to be good, there must be suitable evidence to support any claim that the product developer is making. For a digital health software product to be good, there must be privacy and security protocols in place to ensure that the product will not cause harm to any organizational or individual, patients most particularly. For a digital health software product to be good, sufficient attention should have been paid to usability, to making sure the product actually works in practice and works equally well for every person and every setting it's intended for. For example, if you want to use a digital health software product in a clinical workflow, it needs to dock into your EHR. It needs to not drive your nurses crazy, period. So a good digital health software product has to have evidence to support its claims, whatever they are. A good digital health software product won't cause harm, and a good digital health software product is actually usable in practice by every person it's intended to be used by. It sounds simple, but it's not easy. It's remarkable how hard it is to differentiate between digital health software products in today's crowded market. It's hard to know if a digital health software product is good. And right now, there's no single way. Our regulatory colleagues do an exceptional job giving us confidence that digital health software products making medical claims are safe and effective. But it's beyond their remit to assess whether products that they clear and grant market access to can be reasonably integrated into your clinical practice. There are a variety of different excellent third-party certifications that address privacy and security. But these evaluations can't tell you if a product actually does what it claims to do and works equally well for all people. And let's not even get started on the hundreds of thousands, literally, of health and wellness apps that we're all bombarded with on a daily basis. No one's helping us figure out what will help us and what's digital snake oil that will steal our data and drive us crazy with poor functionality and endless notifications. There are great digital health software products out there, truly incredible solutions that are trustworthy and that will help change the way we care for people and support all of us in our individual health promotion. We have to make sure that this field is sustained by making it easier for end users, health systems, clinicians, payers, and patients to identify these products. We must come together to build a holistic, evidence-based solution that works for everyone. The burden borne by healthcare systems trying to evaluate whether the benefits of a digital health software product outweigh their risks is enormous. The burden is unacceptable and unsustainable. The same is true for individuals looking for digital solutions to safely improve their health and the health of the people they care for. We must reduce this market friction, and we must improve market access for those developers building high-quality, trustworthy digital health software products. We have to make it easier for buyers, whether payers, health systems, or individuals, to readily identify which software solutions are worth considering further. In a crowded market, we have to make it easy to know which digital health products have a baseline level of quality and trustworthiness. We have to remove the risk of a developer doing all the right things, being unable to differentiate themselves in the market. We need a common benchmark for what good digital health software looks like. We also need a common platform that developers can use to demonstrate that they've met this bar. We need a trusted third party, one that can synthesize best practices across the domains of evidence, privacy, and security to help identify high-quality digital health software products worthy of our trust. Earlier in this series, we underscored the importance of third-party evaluation in our complex healthcare industry. We made the case that it is time that developers of high-quality, trustworthy digital health software products have a common, unifying way to differentiate themselves to buyers and end users in our market. I believe that Dime boasts the right community of experts, leading the field in the best practices underlying digital health and relentless in our pursuit of advancing the safe, effective, and equitable use of digital technologies to serve as this trusted, independent third-party evaluator. In fact, I believe we are the only organization that can. And yes, we've already done the hard work. Over the past year, we've reviewed well over 1,000 scientific articles. We've examined 47 different regulatory guidances. We've assessed over 100 different industry standards and quality programs. We've engaged hundreds of industry, innovator, regulatory, and patient leaders to deeply understand their needs. Your needs. By looking at digital health software products across the care continuum, across different end users, and across a variety of different domains, we've synthesized an evidence-based framework that stands on the shoulders of existing standards, regulations, and best practices to accelerate the adoption of high-quality, trustworthy digital health software products by earning the trust of their users. So, what is the solution we've built? Well, we'll be announcing that shortly, though if you're a developer in our community, drop us an email at the link in the comments and we'll get you early access. And if you're an end user of the digital health software products that we've been discussing over the course of this series, and you want to be the first to know when our solution becomes freely available to you, grab the links below, sign up to receive our monthly newsletter, and follow us on LinkedIn. There is no doubt in the promise of high-quality digital health software products to improve lives. I'm excited for what's to come and thrilled to invite you on this journey. We owe it to ourselves as we work tirelessly to improve lives every day, and we owe it to the patients who need us.